Hey guys, Grizzly Legs here, and I'm back with my friend Matt. And today we're going to talk about some medical equipment that we think is the bare minimum you should have, and then we're going to get into what other stuff you should have. This is in response to some videos that you'll get to see later.
Yeah, so if you're trying to build out a trauma kit, IFAK, something like that. Before we get started though, this is not medical advice. We're not doctors, we're not even paramedics, just two dudes talking about medical gear. Get training. Training's the most important thing, and you can't truly learn how to use this stuff by watching a video. You need training.
Yep.
Alright, so if you're going to put together a trauma kit, an individual first aid kit, that kind of thing, life-saving emergency medical gear, there's really 4 items that are the absolute bare minimum. There's more than that, but we'll cover kind of the big 4 first and then move on. So the first one's going to be a tourniquet.
Exactly. So there are 2 common styles of tourniquets on the market right now. One of which being the CAT, the Combat Application Tourniquet, and the other being a SOFTT-W. They both work about the same way. They both have the same purpose, and that's to stop major arterial bleeding, and that is major arterial bleeding on an extremity, where this can be wrapped around and stitched down.
So like, oh my gosh, that's a lot of blood. There's bright red blood squirting, it's pooling on the ground. If you don't stop the bleeding, person's gonna die.
That's the amount of blood that warrants a tourniquet. And so...
so the way you're going to use a tourniquet, say I've got a gunshot wound on my arm. It's bright red squirting, oh my gosh, a lot of blood. I'm going to put a tourniquet on. I'm going to slide this up onto my arm. I'm going to go 2 to 4 inches above the wound. Above meaning closer to my torso, because arteries are springy. Sometimes they retract back up into your body. You don't want to put the tourniquet directly over the wound. Oh, and if you forget the 2 to 4 inches, go high or die is the thing to remember. Tourniquet, go high or die. Just put it all the way at the top of the limb. You'll be fine. You're going to get all the slack out of it as much as you can. Kind of awkward to do with one hand, but it's doable. You're going to pull that nice and tight. Then you're going to take this stick, it's called the windlass. You're going to turn it until the bleeding stops. It's pretty hard to turn. It's going to cause the patient a lot of pain. You're going to secure it when you're done, but you got to do what you got to do.
Yep.
So.
And the measure of completion for the tourniquet is when the bleeding stops.
Yes.
When the bright red blood stops shooting out of the body. Also, the windlass should be on the outside of the body. So, these should be set up for one-handed use in case you don't have a buddy sitting right next to you. So you can do it on yourself. When they come in the package, they're in this plastic, and they're typically not set up for one-handed use. But, lucky I'm here, I'm going to show you how to do it. So, when you get it, it's going to be undone, or whatever, and you're going to make a loop. And then you are going to close the loop, and you want that loop to be about big enough that you can get it all the way up your thigh. And then that'll set yourself up for success, and then you can fold it however you want, as long as it's all out of the way. Super simple, just
Z-fold it.
Doesn't have to be pretty, just as long as it's there.
You want it so when you pull it out of whatever it's in, opens right up, you got that loop, you can put it on, and you're good to go.
Exactly. Another good thing to have with the tourniquet is a Sharpie to write the time that the tourniquet was applied. There's a common misconception that if the tourniquet gets applied, you're going to lose the limb. And that's just not true. That may have been true 15, 20 years ago, but
people thought it was true.
Yeah. And with today's technology, it's something like after 8 hours of correct application, the potential to lose that limb lower than the wound comes into play. So
if you're unsure, if there's a lot of blood and you're unsure, should I put a tourniquet on? Does he really need it? I don't know. Just put it on. The person's limb is going to be fine, especially if you're in civilization, you're not out in the middle of nowhere. It's going to cause them some pain, but you'd rather put on the tourniquet and not have needed it than be too scared to put it on and then the person bleeds out right in front of you because you were too scared to act. The exception to that is like if they have a scrape or a small cut, don't put a tourniquet on there. It's totally unnecessary. Just put a Band-Aid or put some gauze on it. So as far as which tourniquet to get, you're going to want to get a tourniquet that is approved by the Committee on TCCC, which is Tactical Combat Casualty Care. They have a whole list, all documentation of what tourniquets are the best. If you don't want to get into all that, just buy a SOFTT-W or a CAT. Be careful, there's a lot of counterfeits out there on Amazon. If you buy a SOFTT-W, make sure it is from Tac Med Solutions, and if you buy a CAT, make sure it's from North American Rescue. They're both going to cost you about 30 bucks. If they're not from the right vendor or if they're cheaper than that, you're buying a fake and you might die. So, quick side note on an arterial bleed. The reason we put such an emphasis on speed, staging the tourniquet, acting fast with packing the wound or applying the tourniquet is an artery is a major pathway for blood flow away from your heart in your body. Depending on how severely damaged that artery is, depending on the injury, a person can potentially bleed out in less than 2 minutes. They can die right before your eyes. So if you see a patient with an arterial bleed, there's bright red blood squirting, you need to act as fast as you can, and your gear better be ready to go if you want to have a chance to save them.
In addition to that, something we didn't mention before, the CAT tourniquet will work on pediatrics. However, the more recommended tourniquet method would be with a SWAT-T. It's basically a giant rubber band, and how you use that is you wrap really tight until the bleeding stops.
So your next item is going to be some kind of combat gauze. So Celox or QuikClot are the fancy ones. They're basically gauze that have a special powder in them that helps blood clot faster, or these are pretty expensive. You can just get some regular North American Rescue Z-fold gauze. Does the same thing, just doesn't have the powder in it. So what combat gauze is for is if you have major life-threatening bleeding and arterial bleed, oh my gosh, that's a lot of blood, but it is not on an extremity. So it's somewhere you can't put a tourniquet on. It's maybe up in your shoulder, at the very top of your arm, or if it's in the groin area. So you need to do something about that bleeding, but you can't use a tourniquet. So the way you're going to use combat gauze, I'm not going to tear this open because it's expensive, but you're going to tear it open. There's going to be Z-folded gauze in there. You're going to pinch the end of the gauze between two fingers. You're going to stick it into the wound pretty far. It's going to be nasty, but you got to do what you got to do. You're going to push that gauze all the way in, and you're going to try to find the warmest spot because that's the source of the bleeding. That's basically where the artery is. Once you find that, you're going to come out and you're going to just keep grabbing the gauze and pushing it in, push it in, push it in. Keep a lot of pressure on there. Fill up the whole wound cavity, and once you're done, keep firm pressure on the wound to help the blood clot and save the patient's life. So once you've got the wound packed, you might want something to hold pressure on that wound.
A great way to do that is going to be a compression bandage, or an Israeli bandage, or an H&H bandage. Super easy to use, and so yeah, they come in packaging. So this one's sterile, this one's for training purposes. It has instructions if you don't know how to do it, but we're about to show you. So, crack this baby open. Oh no, you've been shot and you've already packed the wound. Gauze side to the wound. Wrap this thing around there, and it's got this great little cleat thing. So I'm going to wrap it as tight as I can. This around there, and stuff it in the inside of the cleat, which shouldn't be this difficult. There we go. And then I'm going to reverse, and that is going to push pressure onto the wounded area, and then I'm going to wrap until I hit this little piece right here. Is another set of hooks, and then I'm going to hook that onto the wrapped part already, and that will prevent that bandage from moving around, and now the patient may be ambulatory and you can move it without having two hands on it.
Right, so another use for a pressure bandage like this, maybe there's a wound on the patient that's not necessarily life-threatening. Maybe I've got kind of a nasty gash or a graze on my arm. It's more than a scrape or a cut, but it's not squirting bright red blood. It's just you want to stop the bleeding regardless. You want to cover it up, protect it. You can just take a pressure bandage like this, throw it right on top of that wound, attach it the same exact way, and it'll help stop the bleeding, and it'll help keep things protected and covered up.
Yep.
So,
alrighty.
all right, so your last absolute bare minimum item is going to be what's called a chest seal. They come in pairs, and these are used for when you've got a gunshot wound or some other wound in the chest cavity area or the lower torso. You can't pack a wound in this area because when you're packing a wound, you're creating pressure by pushing the gauze in there, and the muscle and flesh is kind of pushing back. If you try to do that in the chest cavity or the torso, all you're going to do is push their lungs around or push their guts around. It's not going to work. It's going to make things worse. So what you need to do is seal off that wound so that air doesn't get sucked into their chest cavity and put pressure on the lungs, cause them to collapse, make the patient have difficulty breathing. So if you've got a wound in this area, it's called a sucking chest wound for a reason.
Go figure.
That indicates you should use a chest seal. They come in pairs for entry wound, exit wound. So all you're going to do, open this up, pull the chest seal out. It's basically just a big sticker. So you're going to peel the back off the sticker, slap it on there, make sure it's firmly in place. Do the same thing on the back if there's an exit wound. Then you're going to want to monitor the patient. Chest seals, the HyFin chest seals we have here are supposed to have a valve on them, a one-way valve that lets air come out but not go back in. Usually works, but not always. You might have to burp the wound yourself. If the patient's still having trouble breathing, you might have to peel it up, let some of that air escape, and then stick it back on.
Yep.
So moving on from the, I guess the big four, the bare minimum items, there's some other things that are good to have. So this is called a decompression needle. Now, really important thing to know with this, you absolutely need training to use a decompression needle. There's a very specific spot it has to go. You will absolutely make the situation worse if you don't know what you're doing. You might stab them in the heart and kill them, or stab through their lung and make another hole. And this is really not something you want to use unless you absolutely have to. So be careful with these.
Correct. Now, on a significantly lighter note, the NPA, the nasopharyngeal air tube, is lots of fun to play with, but it also can open up the airway. If someone's face is smashed in from a motorcycle injury, or maybe they took a rubber bullet to the face, or you take a real bullet to the face, and you need to open an airway more efficiently. This goes into the nose, and it comes down the back of the throat, just a little bit, and it clears the airway to allow ease of breathing. And that's just exactly how that works, and it's that simple.
Yeah, it's just a tube that goes in your nose.
Yeah.
So another thing that could be nice to have is burn dressing. This could be for something as simple as you're at the range, you get brass down your shirt, you want dressing to put over that burn, or maybe there's a car accident, somebody's car is on fire, they get burned pretty bad. You want some kind of dressing to cover up the burn, prevent infection, help stop the burning process, cool things off, maybe relieve some pain. These are really good to have. In addition to that, if you have room, it's always good to have extra gauze.
Yep.
For more wound packing. Maybe there's multiple patients, multiple wounds. It's just good to have extras. Other stuff that's good to have is like boo-boo kit type items, just really minor things like Band-Aids, antibacterial ointment, just stuff that's obviously not for anything life-threatening, but it's just good to have.
Ouch, I've scraped my knee, not like, ouch, I've been shot.
Yeah,
What's
so
the difference there?
if you got the space, convenient to have.
Yeah.
The next two things technically are not like medical items used to treat the patient, but they do have a place in pretty much any trauma kit or first aid kit. That's going to be trauma shears and gloves. Shears being so you can cut away clothing, shoes, armor, anything that's in the way of the wound so you can access it easier. These things are legit. They'll cut through coins, they'll cut through boots, whatever you need. They're like 13 bucks on Amazon. And then gloves, just obviously to protect you as you're treating the patient. You might be somebody you don't know, there's blood everywhere, you don't know if they have any diseases, you want to keep yourself safe. Obviously you're not going to stop and take the time to put gloves on if your buddy's bleeding out, but still just good to have.
So all of this begs the question, how much should I carry? How much is too much? How much is enough? Well, there's a good middle ground that will let you carry stuff that will help you treat yourself and treat others and stay mobile. So it's important to consider that when packing your kits up and making your bags, your go bags or your medical bags, that you need to have enough for you and for the 4 major items, and then maybe some extra stuff for your buddies. But you need to be able to carry that weight and stay mobile in that weight.
So a lot of people have the mentality you can never have enough medical gear, which depending on the situation you get into, that can absolutely be true.
Yeah.
But, you know, there's limits to what you can carry. So use your judgment. Make sure you have at least the bare minimum. If you can carry more, by all means, carry more.
Yeah.
You won't be sorry if you ever have to use it. So that leads us into carry methods. What are you going to carry this stuff in? So we've got something just like a pouch like this. I use this to throw in a backpack when I'm hiking, or I've got a bigger one that I keep in my truck. If you're using it for a plate carrier kit, you might have a chest rig. You might use a front pocket on your chest rig to throw some items in. You might have some kind of dangler system like the Spirited System sack or the Faro Concepts dangler. These are nice because they give you a little more room. They're easier to access. Or you might want to have some kind of belt mounted kit like the T-Rex Arms Med 1 pouch or just anything like that. We're not going to go into specifics of carry methods in this video. That's not in the scope of it, but in general, you want something that is secure so you don't lose your gear. You want to be able to access it easily with either hand, and you want some kind of way of securing the gear inside of it and keeping it organized. So For example, inside here you can see this webbing and this mesh pocket that keeps everything in place. Last thing you want is your buddy's bleeding out. You go to rip into your kit, you need to get what you need to get, and then everything falls out. The wind blows, half your stuff blows away.
Oof.
Had that happen to me before. It's not ideal. Try to organize it in some way.
So, a video is no substitute for training. It's important to get hands-on class that is both informative and allows you time to practice with the equipment you will likely be using. Watching this video does not make you a medic, and we've both had hands-on training in several different levels of care, and we are have a better understanding of how this equipment works because of it.
Absolutely. You don't want the first time you ever have to use your gear to be in a life or death situation. If that ever happens, you might be freaking out. Maybe you never saw that much blood before. You got a huge adrenaline rush, your hands are shaking, your thoughts are racing. If you've never tried to use this gear before, you're gonna screw it up. You're not gonna figure it out, you're gonna do something wrong, maybe you'll take too long. Another thing a lot of people don't consider is you might have a patient that wants nothing to do with you. Maybe they're in a lot of pain, they don't understand the severity of the situation they're in, saying, no, go away, leave me alone, but you're looking at them like, this person's gonna die if I don't do anything. In that situation, you need to have the confidence and the knowledge to respond appropriately. Otherwise, if you just have the gear and you just watch a couple videos, you are not going to help anyone in that situation. So just some good classes to take. CPR, real easy, real common one. Red Cross classes are okay. They cover more basic like boo-boo kit type stuff. Any kind of trauma class, stop the bleed. That's the kind of stuff you want to look for.
Wilderness first responder class, those are really good. They're like 8 days and they're really super intense.
Yeah,
and even a basic lifeguard class is will give you, a foot in the door with CPR and trauma bleeding and head, neck, and spinal injuries, and those are all really great options to get like base level training that will help you tenfold.
At the very, very least, after you watch the video, say for whatever reason you can't take a class for a while, get the gear so you have what you need, and then practice on yourself. Stage your tourniquet, practice applying it, put yourself under a timer so you're under stress. Just know how it all works. So again, the first time you're using it is not when you need it.
All right, guys, that wraps us up, and thanks for watching. If you have any questions or comments, drop them in the box below, and we will answer every question you have. I'm Jay, and that's Matt. Thanks for joining us.
Breathe. You're good, bro. You're good. Yeah, good. 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 It's all right. You say.
I know.
Breathe.
You're not. We just don't want you to bleed. Okay?
You're good. Stop it. You're good.
It's coming out of your life, okay? You're fine. You're fine.
Like Zoink Scoob, I think she's got an extra chromosome. Ruh-roh, Raggy! Retard!